Good morning, everyone. We'll start today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. This morning, we'll also be hearing from Rabbi Laurie Rice of Congregation Micah with a special message for the Passover holiday. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department and Dr. Michael Caldwell, Director of the Metro Public Health Department, are with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. Now, it grieves me to report another 3 fatalities related to the coronavirus since yesterday morning, and we mourn each of these lives lost to this disease. But yesterday we also lost John Prine, a Nashville legend, whose songs have always reminded us how beautiful and fragile is each human life and each human heart. And his death makes all the others more painful, too. We send all our love and our deepest condolences to his wife Fiona and to the loved ones of everyone who has died. Now, as Dr. Jahangir mentioned yesterday morning, we cannot let up on our efforts to flatten the curve of the coronavirus disease in our community. We must stay the course, and I urge everyone to please continue staying at home as much as possible and only leave your home to run errands that are absolutely essential, like shopping for your weekly groceries or picking up prescriptions. Enforcement teams comprised of personnel from Metro Public Health and Metro Nashville Police continue to patrol and investigate suspected violations of the Safer at Home order. And I want to remind everyone that you can report suspected violations by dialing 311 from anywhere within Davidson County, visiting hub.nashville.gov, or downloading the Hub Nashville app. Now, this morning, I'd like to thank Nashville's first responders and public safety personnel, including our police officers, firefighters, EMTs, sheriff's deputies, and 911 dispatchers. Under normal circumstances, these courageous individuals have incredibly difficult professions. But since March 3rd, our citywide tornado recovery efforts and coordinated COVID-19 response has demanded even more from these who keep our community safe. We owe our first responders and public safety personnel a tremendous debt of gratitude. Without them, we could not have overcome the challenges that our city has faced in the past. And we know they're equal to the task in front of them today, as our city does face a historic challenge in the coronavirus pandemic. Now, I'm happy to provide several updates regarding the community-wide financial support for those of our neighbors recovering from the storm or facing hardships during the pandemic. Now, yesterday afternoon, the Community Foundation of Middle Tennessee announced 15 additional grants totaling $592,000 to area nonprofits and organizations helping victims affected by the deadly March 3rd tornado. The Middle Tennessee Emergency Response Fund Advisory Committee approved the latest rounds of grants focused on immediate relief needs, food, shelter, basic necessities, and direct cash assistance. Example recipients include Gideon's Army, which is providing housing placement and other direct financial assistance to individuals and families living in North Nashville. Heartstrings, an organization providing direct financial assistance to musicians living in Nashville. And the Nashville Food Project, which is providing prepared meals to individuals and families, including seniors, through a network of community partner agencies. To date, 83 grants to 71 nonprofits and organizations have been deployed from the Middle Tennessee Emergency Response Fund, now totaling deployment of $2.72 million. The fund now has over $11 million in contributions and in pledges. Some of the money from the pledges have not yet come in. The Community Foundation will continue funding both relief and recovery grants as more pledge commitments are received by the foundation. To apply for a grant from the Community Foundation or find a list of grant recipients providing direct individual assistance in Davidson County, please visit tornadoresponse.com, which is easy to remember. The website, again, is tornadoresponse.com. Now, I'm also pleased to report that the COVID-19 Response Fund has deployed its second round of funding. $520,000 has been distributed to 27 local nonprofit organizations that are helping individuals and families impacted by the coronavirus outbreak. The COVID-19 Response Fund has distributed $820,000 to area nonprofits since its creation. Now, the latest funding recipients include the Interfaith Dental Clinic, the Mental Health of America of the Mid-South, Second Harvest Food Bank of Middle Tennessee, Faith Family Medical Center, Insight Counseling Centers, Matthew Walker Comprehensive Healthcare, Meals on Wheels, the YWCA Nashville and Middle Tennessee, and the Nashville Diaper Connection. The COVID-19 Response Fund, done in partnership with United Way, now has raised $3.69 million with pledges. And thanks to these gifts from local foundations, corporations, and community members, and to contribute to this response fund and learn how to obtain direct financial, food, mental health, or social assistance from the fund, please visit covid19.nashville.gov. As a reminder, you can also visit Metro's COVID-19 website to learn how to make protective homemade face coverings. I urge everyone to wear these face coverings in a public setting where other social distancing measures are difficult to maintain, such as grocery stores and pharmacies. Again, this type of protective equipment is not intended to be a substitute for safe social distancing. It is meant to provide an added layer of protection for you and those around you while outside the home for essential purposes. You can also donate homemade masks to the Community Resource Center at 218 Omohundro Place, Monday through Friday, 9 a.m. to 3:30 p.m. Your donated masks will be distributed to essential personnel who are not healthcare workers or first responders, but are nonetheless part of Nashville's citywide COVID-19 response. To anyone interested in learning how to make or donate homemade masks, just visit covid19.nashville.gov. Now today, April 8th, marks the beginning of Passover, which is traditionally a holiday observed in community for our Jewish friends and neighbors. And I'm grateful to Rabbi Laurie Rice of Congregation Micah for providing us with an important message this morning about the importance of practicing our faith while also prioritizing our health and the well-being of those around us. And with that, I'll turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force. Thank you.
Thank you, Mayor Cooper, and good morning. Here's the latest information on the COVID-19 virus in our city. We now have a total of 1,140 confirmed cases, an increase of 65 cases over the past 24 hours. As the mayor reported, this morning I too am saddened to report the death of 3 additional Nashvillians, a 48-year-old gentleman, a 74-year-old gentleman, and a 75-year-old gentleman. This brings the total COVID-19 fatalities in Nashville to 12. I send my condolences to the families and friends of these individuals. Additionally, 1,139 confirmed cases have been reported in our surrounding counties. This means there are nearly 2,300 cases in Middle Tennessee. Of the 1,140 confirmed cases in Davidson County, 45 individuals are hospitalized. 923 cases are self-isolating at home and have mild and manageable symptoms. 160 people have recovered and have been deemed cleared. This morning, our community assessment centers are open at Nissan Stadium, at the Old Kmart in Antioch, and at Meharry Medical College. These are drive-through screening facilities that are open to all Davidson County residents at no cost. So far, more than 1,300 people have been screened, and wait times have been less than 10 minutes, with the results returning within the 1 week. The assessment centers are open Monday, Wednesday, Fridays from 9 a.m. to 3 p.m. These sites are a part of our larger community assessment system, which increases our capacity to screen more residents and conduct more COVID-19 tests. If you think you may have symptoms, first call our hotline at 615-862-7777. Again, 615-862-7777. This is open 7 days a week from 7 a.m. to 7 p.m. You'll be connected to a medical personnel who will assess your symptoms and determine if you need to have further assessments and screening. And if you do, they will refer you to either your primary care physician or to one of our community assessment centers. I want to also address an important issue that this crisis is highlighting, and that's the issue of health disparities. I'm sure it surprised some, but not others, to hear that African Americans account for more than half of those who have tested positive and 72% of virus-related fatalities in Chicago, even though African Americans make up less than 1/3 of the Chicago community. Unfortunately, health disparities, particularly amongst people of color, is a problem that our country has faced for hundreds of years. Infant mortality for African American children is 2.5 times that of white children. African Americans have a higher rate of underlying medical conditions such as diabetes, hypertension, and asthma. Native Americans and Latinx individuals have a 30% higher rate of diabetes. And a child born right here in Nashville, 2 children that are born have perhaps up to a 20-year difference in life expectancy because of the zip code in which they live. This is a problem. And the people this virus impacts the most are those individuals who are the most vulnerable medically. This happens to be disproportionately minorities and those who have limited access to health care. I think it is important to know this information within our own communities. As chair of the Metropolitan Board of Health, I have directed Dr. Caldwell and his team to gather information on race and ethnicity as best as they can for all Nashvillians who test positive for this virus. When this data is available, which I hope will be soon, we'll make sure to share this with you. Finally, we're constantly looking at the modeling and studying the data. And while I do believe that our efforts thus far have helped flatten the curve, we still do not know for certain when our peak of cases will occur. What I do know, however, is that we are still on the upward part of this curve. More people are getting sick, and I'm sad to say more people will die. I ask you to remain vigilant and please stay the course. I am sure that many of you have a bad case of cabin fever. That's frankly the case of me and my family as well. As you do stay at home, please remember to have patience with others. Remember, we are all together, but especially in your home. Keep as much regular routine as you can. Stay physically and mentally busy. Take a walk, keeping a safe distance from others. Read a book, or as we did in our family last night, play charades or board game. Connect with others, FaceTime relatives, call friends, and text them. Also, it's okay to spend time alone. With more people at home, you might need a little time apart as well. But above all, please stay home. Before getting out, ask yourself, is this trip really necessary? Plan ahead, make fewer trips for essential items, and return home as quickly as possible. I'm grateful to all of you for your perseverance and dedication to our community. And I'd now like to turn it over to Dr. James Hildreth. Thank you.
Good morning, Nashville. In a previous conversation, I shared with you how powerful mathematical models can be and how they shaped every aspect of our daily lives. The state has been using a model from the Institute of Health Metrics and Evaluation from the University of Washington to make decisions about what we do in the state of Tennessee regarding COVID-19. And the latest models appear to indicate that the Tennessee curve may in fact be flattening. But there are a couple of things to consider before we go out into the streets and have a big party and go back to normal. Models are only as good as the data or information that goes into them. And as you all know, the testing in the state and in the country has been less than desirable because the kits have been limited. Therefore, modelers have to make assumptions, and one of the most important assumptions they've made in this model is that all of us will stay at home, will practice safe distancing, and do the other things we've been asked to do. So in fact, if we don't do those things, the assumptions will be false and the models will fall apart. And so it's really, really important that we stick to the course, do the safe distancing, stay at home, because then the model, in fact, will support what it seems to show right now, which is that the curve may be flattening. Statisticians teach us that the more observations we have when making decisions, the more powerful and fateful those assumptions can be in undermining or underpinning the decisions we make. They refer to this as statistical power. The latest worldwide data for COVID-19 shows that 1.4 million people have been infected. This means that there will be a great deal of power in the decisions we make looking at what has happened in other places. And so with over 1 million data points to consider, the statistical power of these decisions will be tremendous. In Washington State, China, and South Korea, we now can say with a good deal of confidence that social distancing, saying safer at home, and all the other things we've been asked to do, they actually work. So I'm asking that we continue to do the things we've been doing because the evidence suggests that, in fact, it will flatten the curve. So there is evidence emerging, as you've heard, that African Americans are getting more severe disease from COVID-19 and dying at a much higher rate. The science and biology of COVID-19 predicted this. It shouldn't be a surprise to anyone. In fact, in China, which is a very homogeneous country racially, they recognized early on that if you smoked, had a heart condition, diabetes, and other diseases, you're much more prone to get severe disease and to die. And keep in mind, again, this is a racially homogeneous country. So we can, with some confidence, say that underlying conditions predispose to severe disease and to dying. So it should not be a surprise to anyone in the United States of America that poor folks and African Americans and even whites who live in certain zip codes would have a much more severe disease burden with COVID-19 than others might. And we have other examples of this. I've been studying HIV for the last 40 years or so, and we know that in this country, even though African Americans only make up 13% of the population, they account for 43% of all the HIV cases. So this is not new news. This is old news. It's an old scenario repeating itself. And I have to say that here in Nashville, we are blessed to have leadership that has acknowledged the importance of collecting these data. And so I give my thanks to the mayor and to Dr. Jahangir for making that decision, because we can't really understand what is happening without data. For example, I've heard people say that African Americans are more susceptible to the virus. That is not correct. Susceptibility is determined by the receptors for the virus, and as far as we know, those are evenly distributed against population groups. What African Americans are more susceptible to is more severe disease, not to the virus. Everyone is getting infected, but some people have more severe disease than others. That's what's really happening here. Let me also say that we should be taking steps to protect all the vulnerable populations in this country. Nursing homes, assisted living facilities, one story after another shows that in those confined spaces, when you have elderly folks with underlying conditions, it's a disaster waiting to happen. So as far as I'm concerned, we should be taking preemptive steps to protect everyone who's vulnerable because we know that they are, and we can do that. And let me just say that this is not strictly an issue of access to health care, because health care only accounts for 10 to 15% of us being healthy, and that's been known for a long time. And we have some extraordinary healthcare systems here in Nashville, and I can say with complete confidence that the leaders of those healthcare systems, if they had any suspicion that there was bias or discrimination in dealing with COVID-19, they would take steps to correct it. So this is not really a surprise. It's just pointing out something that has existed in the country for a really long time. And as you heard, your zip code has more to do with your health in some cases than how much money you make, what color you are, what your religion is. So this is a much broader issue than COVID-19, and it's going to take some time to fix it. So I think that we have great leadership in Nashville, and this is not strictly a Nashville problem, and we'll get past this. And finally, let me just say a few words about this coming weekend. This coming Sunday is Easter Sunday, and it's the most sacred holiday of the year for millions of Americans and billions of folks around the country, the world. And there's going to be a great temptation to celebrate and worship together. That would be a huge mistake and put lives at risk. So I ask if this happens, make it virtual, and let's save lives. Nashville, we got this. The indications are we're doing a great job. Let's keep it up. Stay apart, stay home, stay safe. And by all means, Nashville, let's not be a vector for COVID-19. Thank you.
Thank you, Dr. Hildreth. And now, a special Passover message from Rabbi Laurie Rice of Congregation Micah.
Hello, Nashville. My name is Rabbi Laurie Rice from Congregation Micah. Tomorrow evening at sundown, the Jewish people celebrates one of the most sacred holidays of our year, the holiday of Passover. Redemption from slavery to freedom, which is essentially a narrative about hope, is what this holiday is all about. But it's also a story about God's protection. And here's the thing, hope and divine protection are not enough for us this year. Our role in this story is more important than ever, because we know that one of the biggest issues with COVID-19 is that you can have it, but do not know that you do. You can go about your normal day and over the course of 5 days infect 2 to 3 people. And then those 2 to 3 people can go on to infect another 2 to 3 people. And by day 30, you've infected 406 people. But simply by staying at home, not going to work, limiting your visits to the grocery store, the number of infected people reduces considerably. The effect is this: it reduces the impact on the health system so that if you or your loved ones get sick, Nashville will have the resources to treat them. So I implore you, if you truly want to be a partner with God in the ongoing betterment of our world, stay home and wash your hands.
We will now start the Q&A portion of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We'll start with Tosin Fakile at News 4. Tosin.
Good morning. Thank you for taking our questions. I have 2 questions. The first is in regards to the heat map. Were the large gatherings you guys were talking about before or after people were told not to gather? And do you think that has some kind of correlation with like the bars being shut down? Do you guys maybe think that should have been shut down sooner? And my second question is, we were by the music center and we saw lights on, so we're trying to figure out, is there a green light for activity setting up the 600 beds there for the new facility that the governor was talking about?
Thank you, Tosin. Dr. Jungir.
Thank you, Tosin. In regards to the heat map, that heat map was collective of all the cases. As I mentioned yesterday, the big clusters you see are, again, I'm not getting into specifics, as has been seen around the country, around social gatherings such as religious events, fundraisers, school events, or big family gatherings. I believe we as a city led this in closing facilities and to non-essential things faster than anywhere. So do I think we should have done it sooner? I think did it quicker than probably possible, and we did a great job there. I'm very proud of that. That it has helped flatten the curve. Regarding the Music City Center, there is work going there. Yesterday, Dr. Caldwell, Chief Swan, and I toured the place. Met with the leadership team there, led by Mr. Norton. We will set up a time whenever for the media to come tour it whenever, and in the very near future. We're just finalizing those data, that time. But in short, work is going on, and they've been working around the clock. So what you saw was people doing what they need to do to make sure our city's prepared. Thank you.
Peter White at the Tribune.
Hey, heat map, can you hear me?
Yes, Mr. White, go ahead.
I have a question about the heat map.
Go ahead.
Can you hear me?
Yes. Mr. White, we can hear you.
Hi, now I hear you. Where can I get a hold of this heat map? Can I call Brian Todd for it?
Well, we sent it out. I'm happy to send you a copy of it as well.
Thank you.
Okay. Or again, rather. Caress Checkman.
Good morning. I have two questions. One, in terms specifically for Mayor Cooper, in terms of demographics, what is our African American population in the city of Nashville? And number two, what can you do on local level to help the African Americans who may face these pre-existing conditions and want to get treated, or who are working jobs that require interaction face to face? I spoke with one woman, for instance, yesterday at the grocery store who's working that job and has to go out and do another, but is also worried about her health. So I guess what would your advice be to them, and what are you doing on a local level to help people in that demographic?
So the second part of your question was, what are we doing about folks who are going out and still working essential jobs in the community? Is that right, Caress?
Yes, sir.
Okay.
Yes, sir.
Thank you. Mayor Cooper?
The African American community in Nashville is, depending on various counting, about a quarter of our population. And that is a population, as Dr. Hildreth has been saying, that disproportionately is vulnerable, often due to underlying health conditions. Being focused on the vulnerable population is very important. And that's one of the reasons that the assessment centers are free. And also, I believe it's national policy as well as state policy and our local policy. The treatment for COVID-19 is also going to be free. So there is no barrier to being treated. It's just we need to be especially aware of our neighbors who may all of whom are heroes. You know, this is an environment where the grocery store workers are essential, are needed. Never have their service to their community been more appreciated and regarded. They need to be especially careful. And the way we can help them most is by us social distancing, is by us behaving with protocols to honor their service because we need them. Now, if they feel like they have symptoms, they need to call the hotline. The hotline, I mean, your traditional care is always available to you, but at city support, the hotline is there. There's a very low wait time. They've done a great job. They're doing it in multiple languages. The assessment is very valuable. And then getting you to a testing center, an assessment center and testing, that also has gone very smoothly. There's not a long wait, and the response back from the tests has been remarkably quick given the national stories that you hear about those responses. So your friends who are working in essential services for their community, first, thank them, and then second, encourage all of us to keep them safe by our own conduct. And third, should they feel some health concerns, then encourage them to call the hotline and to become tested. And that's how they're going to continue to serve the community. And then Nashville right now does not, has been our breakout, our case is not disproportionately weighted into one community or another, as far as we can tell. But we're doing the data work now to really make sure of that. The heat map, I think, reflects that there was a kind of a university area intensity to this in the beginning, but otherwise there are parts of Nashville that still do have no reported cases, for example. And the heat map itself it's just the data. That's what it is. We wish that there were no dots for any case, but it is what it is. It's heavily concentrated in southwest Nashville and then to some extent in Antioch as well, but that's also where population density is, as another question. And then our hospitalizations are very good for a city with this many cases. And the hospitalizations that we've had in terms of it seems to reflect the demographics of the county as a whole and not be overweighted in a vulnerable population in particular. But thank you, Chris, for your question.
Harriet Wallace.
Yes, good morning. We are now, I believe, about a month into responding to the pandemic, and it is common practice for most, if not all, health departments to collect critical data that we know can inform policy and strategies that can help save lives in particular demographics, but also stop the spread to all demographics. Why now are we just now starting to collect this data when health departments commonly do that on the front end? And if you collected samples, test samples from outside or remote centers, why was there not an insistence from them to send you that data? That's my first question. My second question is, what about the underlying conditions? Do we have that data yet to look at pre-existing conditions and the rate of those who are sick or dying from the virus? And when I'm talking about heart disease, asthma, those high-risk diseases. Thank you.
Thank you, Harriet. Dr. Jungier.
Harry, thank you. So to answer your questions, a couple of things. When one receives the test, the information that is typically collected from one of 18 or so places that do the testing here is, ethnicity, name, age, contact information, and race. You're right, has not historically been part of that, nor are underlying medical conditions part of the initial form for the report for getting a test. Now, when somebody returns positive, so of the 1,140 people that are positive in Nashville right now, the Metro Health Department then calls each person individually, and there's a whole process that our epidemiologists are conducting. We are actively, and under the mayor's direction, and obviously with as the chair of the Board of Health, I strongly support the mayor's initiative on this, is we're ramping up our number of epidemiologists. So this data that you're mentioning, underlying medical conditions, race has come up a few times, occupation, things like that are being collected when the phone calls are being made. And what I'm asking as chair of the board is, let's tabulate that better. Let's report that out more regularly. That information's there. We just have not done as good of a job, frankly, of being able to report that to you, but we're going to work on that. Now, I do have some preliminary data of hospitalizations, as the mayor said earlier. In our hospitalizations, of the 104 people that have been admitted to the hospital, some of whom have been discharged, some of whom have unfortunately passed away, 49 are white, 12 are African American, and 43 are still unknown at this time what their race is. But I just tell you that to say that those are things we're looking at. But the greater issue here is the vulnerable community, the vulnerable medical population are the ones that get most impacted by this. So that is why we highlight, if you're healthy, stay away from your family members that may not be, because I think, as you're pointing out, underlying medical conditions is what's going to lead to bad outcomes. So we're going to get you that information, and again, my directive is to do it much sooner than we can, as soon as we can. Thank you.
Nancy Ammons.
Hi, thanks for taking my call. Do you have any idea how many Metro employees have now tested positive? I know a week or so ago, Chief Anderson had said, I thought he said it was 20 or 30 Metro officers were in quarantine. Do you know how many Metro employees have tested positive? And also, do you have any idea of how many of them are now working from home?
The question is how many Metro employees have tested positive and how many may be working remotely. Dr. Jungier.
Short answer is I couldn't tell you either one of those information right now, but we will try our best to come up with that answer for you and give it back to you. So I'll just defer to Chris and Brian Todd to make sure we get back to you with that answer. Thank you.
Kara Hartnett.
Hi. My question's on the when the people come. The state is using a model that says that the people come next week, but you guys contend that it'll come in the next 2 to 3 weeks. I was wondering if you can just explain the discrepancy there.
The peak.
So I suspect when you say people come, you mean when is our peak going to hit as far as our most amount of cases? There are several models. The IHME model that Dr. Hildreth referenced with the states using, it does show the peak in the next week or so. There are models more, that model is a national model, an international model. They can narrow it down to Tennessee specifically, doesn't narrow it down to Nashville. Our local health systems are fortunate to have HCA and Vanderbilt have been running their own models, which they're very kind to work with us to share. Is those show the peak is going to be a little later. In fact, we hopefully as early as tomorrow will be able to have some of those modeling people here at this press conference to give you more information around that exact how they came about the models and what the model is showing. What I will tell you, to steal a little bit of thunder, is the modeling thus far, when I was just briefed on both of those models, the HCA and Vanderbilt one yesterday, both of those models have shown a flattening of our curve because of the social distancing and the efforts of our community. So know that we are making efforts, but hopefully tomorrow we'll be able to provide you a little bit more information specifically around those two models. Thank you.
Matthew Torres.
Thank you for taking my question. Are any of the health officials there aware of any swab tests or know of them that were either lost or damaged in the process? And if so, do we have an idea of how many or even how many people had to retake a test?
Sure. So as I mentioned, there are probably 18 or so private labs and state lab and others. I would just say I am sure it's in the 11,000, nearly 12,000 tests that we had conducted in the city of Nashville. I am sure there's been some time where a test was lost or an error occurred. I don't have an exact number. I'm not aware of any within the community assessment centers that we run. As I mentioned, we've run about, I don't know, nearly 1,000 tests in our centers. But I think in any process, to say there's never been one that's not accurate. So I don't know the exact number. I know there's about 18 different labs running tests and many other health facilities and private doctors who are doing these. So I don't have that exact information. I don't know how easy it would be to track. So thank you.
Our last two questions are from Julia Palazzo and Yi Jung. We'll start with Julia.
Morning. Thank you for taking my question. So since we haven't hit the peak yet, do you anticipate opening more assessment centers around the metro area? Also, any updates of non-essential businesses that have been told to shut down that may have been violating the Safer at Home order? Thank you.
So the question is assessment centers that may be open and the number of businesses that have been shut down.
All right. Assessment centers. As of right now, I'm really I think our assessment centers have been operating well. We have low wait times, great turnaround time, and we don't envision any more at this moment. Now, that's not to say that won't change, especially as our peak increases. If we find that there's more of a need, then yes, we will do that. Regarding fines, Mr. Atkins and Dr. Caldwell are both here, and there have been 0 fines issued since our report was a day or two ago, and no additional citations since that time. Is that correct? That's correct. So there you go. Thank you.
And to expound on that, Julia, 106 businesses have been visited by 10 enforcement teams comprised of inspectors from Metro Public Health Department and Metro Police. And Yi Jung with the Tennessean.
Good morning. I had a few questions regarding the now 12 deaths reported here in the county. I was curious if there was a lag time in reporting, and if so, how long that lag time is.
And we've seen now, I believe, all men who have, all 12 of the people who have died are men. Wondering if we've seen any other sort of trends or information you can share, whether that's racial breakdown or the length of their illness.
Could you read the first part of your question again?
Yeah, I was curious if there is a lag time in reporting the deaths. I don't know kind of what the process looks like for you guys.
Thank you.
Okay. So reporting deaths, the way it works is COVID positive patient, death happens, state is informed and we're informed. We have a cutoff time for this report, and the report that I receive every evening from the public health officials around 3 or 4 in the afternoon. So I get a report, I review it, I have questions. So typically the numbers I'm giving to you are of about 3 or 4 p.m. the day before. Regarding the deaths, I did look into that. As we've mentioned, there are 12 deaths thus far that we reported to you. Of that, 7 individuals are white and 5 are African Americans. I will say 12 deaths is a really low number to make any conclusions about the breakdown of that, right? So just those are the numbers. So every day I'll report deaths, and usually those are deaths that happen between 3 or 4 the day before. Thank you.
A recording of this press briefing will be made available later this afternoon. Thank you, everyone, for joining us. This concludes today's Metro COVID-19 press briefing.